history. It's a tool that is both about, embedded within it. And we've had these conversations over the last couple of days, Jamie, about how embedded within it is this very sophisticated structure of surveillance, how to take money, like take statistics literally being numbers for the state, and to process it for the purposes of the state. So obviously for the purposes of the state, when it comes to its economy, its international relationships, how it wants to govern those that are within it. So it is both then a tool of the state, and then on the other side of it, how we try to, how we come to talk about it in organizing, right? Or the way we feel about it when we think about the workforce, right? The frontline workers of it, which is that it is a framework. It is an ideology. It is the idea that we believe in some sort of like health, idea of health, and that everybody should have access to it. And that the best ways to go about it are through education, through nutrition, through having health treatment. And that if you really want a healthy body, it's not that you only have to think about, for example, like what medicines they're getting, right? Or what the best surgeries are, but that you have to then also step back and think about what kind of food are people eating? Do they have access to parks, right? Like what's the violence in their neighborhood, right? That you have to step back even more and say to yourself, well, I want to be able to prevent disease, and I want to be able to promote health, and then I also want to be able to treat it. So we are living in this moment where right now in COVID-19, when we are like looking to public health and we're saying, hey, public health, what's happening? We both see it as somebody who's on our side, like working in our favor, thinking about our health, but then we also have an uncomfortable relationship with it because we're like, but you're still in the service of the state. The information you produce and the knowledge you make and the recommendations you give still have to be in alignment with the policies and the politics of the government. So it means both of these things to me at the same time.
That definitely, with the service to the state, it's very directly related. But while we're at it, so can you talk about the COVID-19 task force on that you co-chair at UCLA on race and equity? Like, what is their goals and what are they looking at?
So sure. I mean, if I had to take all the fantastic things I think the people who are on this task force are doing in terms of addressing directly issues of racism, equity, and summarize it into big areas. One is the fact that they are, from the moment we heard about this, everyone is deeply concerned about what they're calling a vulnerable community. We know who that is, we know who it looks like, and we know where they live, right? So this is, definitely at the center of this. The second thing is not only those who are what we're calling more at risk or more vulnerable, right, to the catastrophic consequences of COVID, but it's also then the policies that we put into place, the recommendations that we make, the way that we go about it itself will bring on a set of collateral consequences to the communities that, once again, we're saying are the most vulnerable. So both of these things, right, both thinking about those who are most likely to get it, right, and have poor outcomes, and then also those who are most likely to be affected by our approach, right, and handling it. Those are issues that sit at the center of the task force. And then also in the task force is this idea of how do our politics at this current moment, right, that have completely been something that we've organized against on so many fronts, whether it's issues of housing, whether it's issues of incarceration, detention, or sanctions, right? Like, what are the pressure points that we know have been building, getting to the idea of what Jamie was saying before, that, when you're always in crisis, right? When you're 1492 in crisis and on, right? When you're always in crisis, then what is a crisis, right? What does that even mean? So for us, it's that how do we, the other part of it, how do we see this current moment as an opportunity to make significant gains in movement and organizing that address issues of housing, incarceration, detention, sanctions, poverty, right? Like occupational, right? Health issues. How do we address all these right now? So it's about us having come together and been really worried, right? When this happened, and then also trying to think about how do we position ourselves for the ground up pressure that's trying to use this as an opportunity, right? To get major gains in movement.
Thank you. Yeah, I just received something from our folks at LA Can, and the latest update is that there's a potential outbreak at the Union Rescue Mission, which is in our community in Skid Row, and that is something that that we've been fighting back, and the city has completely, absolutely failed. And I know that Pete White and some of the other folks, like, just been calling upon this, and now we see that the outbreak has begun. So, what that would look like. So Jamie,
Hamid, can I,
yes,
Hamid,
please.
can I say
Sure,
something to that for a
sure,
second?
sure.
Because coming to this, like, I think, as I know, we are from the position of being, having to react to this news. You hear something like this, you're immediately afraid about the person who, right, is infected. You're concerned about their treatment, where they're going to go get it. You're concerned about everyone else there, and then you're also then concerned about who knows. And like in another relationship with your government, you would be like, well, you want your government to know because your government will be able to give what it needs to that person who needs it the most right now, and
That's
to protect
right.
everyone else. But at the same time, you hear about this, like you react to it in so many different ways, and that's part of why these webinars you guys are doing are so important, because it's, you go through all those emotions at the same time.
Absolutely. Thank you. So Jamie, same question, just as a frontline service provider, and I just want to remind our folks as well that we're going to have this conversation for another 15, 20 minutes, and then we're on till 8 o'clock Pacific time. So please, if you want to type in your questions in the chat room, and if you don't have access to a computer and you're on the phone, you can text it to 562-230-4578, 562-230-4578. So Jamie, going to you, like talking about public health, and of course, we always look at it through the lens of community health. So what does that mean to you as a frontline care provider in a vulnerable community, particularly on the east side? Let me just unmute you. Can you unmute yourself? So what I would ask both Jamie and Bita is maybe not to unmute yourself. Okay, try Jamie. Try to unmute yourself.
Okay, I think
okay.
I'm unmuted now.
Yes.
So, so I'll just kind of go off of that information that you just gave, because, being a nurse in Boyle Heights at a hospital there, and I won't name what hospital it is just because of, politics, just as Bita was talking about. Knowing that, I know immediately where where folks from the Union Rescue Mission will be going. There's only so many hospitals in that area. You have California, White Memorial, you have LA County, and then you have Pacific Alliance. And so for me, and even kind of centering Skid Row in that statement, for me, that means that it's resourced, like that's what I would like public health to me. Like if I had it in a definition that wasn't kind of bringing in all the realities, it would mean that I would be able to do my job with the resources that I need to do my job. And as a nurse, some of the things that you navigate the most are the situations that people come up against in the hospital, not just being sick, but then, the care afterwards. And trying to negotiate that, navigate that, and get a person, whatever you possibly can pull from the system to give to them. And that's what I think why, when I think about what a nurse is a natural organizer, because you're constantly trying to pull together resources in an under-resourced area for a particular person when they leave, and you're advocating for them. Well, and that is a good nurse. And that's the unfortunate thing sometimes, is that in the hospital, you have all kinds of walks of life. So that's one thing, being resourced. And then not to have to fear that the information and the data that gets collected that I use, that I need on a regular basis to do my job, that it's not something that's accessible by the government. I mean, just in default and being part of the coalition and learning about the information sharing environment, sometimes I wonder how all this very, very personal information that I'm being used is now being processed through data analytics and being sold and being shared. And even though when it's not supposed to be, of course, in the back of my head, I'm thinking it probably is in many ways that I'm not understanding. And then I think lastly, and I think Bita touched on this, I think public health needs to also kind of incorporate this ability to heal past traumas, because one of the things that makes it so difficult to be a nurse is that you are the most accessible to the patient. So their anger and their frustration and the feelings of being violated are something that they only have you to navigate that through with, because they don't have access to these larger systems that are, you know, kind of engaging this oppression. So sometimes I wish there was a place for us to be able to heal all those past traumas, because definitely not only just being a nurse and doing the job of a nurse, but holding the pain and the trauma of people as they come in to try to receive services is definitely a big part of the job that is overwhelming sometimes.
So then, can you talk about what are you seeing in your day-to-day care provider practice on the front lines?
So right now, in this current moment, what's happening among a lot of hospitals and things that I'm hearing is basically like things are clearing out. There are no procedures that are being done that are not absolutely necessary to save your life. So, you know, a lot of GI studies are, you know, not being done if people are doing endoscopies, colonoscopies. People may know about that. They're not being done unless absolutely necessary. Surgeries are being canceled. Cardiac procedures that are not absolutely life-threatening are not being done. Hospitals are trying to, and this is the one thing that I think, for me, that I think California has this advantage right now, is that we are being able to kind of clear out and get prepared and have, like, you know, these large ships that are, you know, docked right now, waiting to take patients that are non-COVID patients. There's been, for me, like a feeling of, and I was speaking to another nurse about that today, like a sense of we are able to get prepared as as we continue to surge in cases right now. So, and you know, like I said before, as far as different stories that are coming out of the hospitals as if we are prepared or not prepared, we know as of today, like, you know, they're talking about 100 to 200,000 people that may die in the US. We know that Gavin Newsom at one point said if we don't do anything, about 25 million people in California can get infected. So just knowing that, you know, that this surge is coming, I do want to provide some sense of, you know, not calm, but assurance to people that at least the hospital that I work at, I know that people are moving, people are reacting, people are doing things. Making task force, you know, clearing beds up, getting nurses trained up, and the difficulties that have always existed as far as being resourced, as far as having, you know, enough tools and staff. Like I said, it's not a moment in time, and I won't get specific because now they're even threatening to fire people who speak on the specificities of what we're seeing as far as resources. But again, I just kind of invoke that it's not a moment in time. So what we didn't have before, we don't have today as well. And that's why you know, there's this call for the Defense Act and to make these ventilators and to create this PPE. And I really put a shout out there that, you know, any PPE that you have available or you have become available to should really be donated to your local hospital so that folks are prepared, while we also creatively learn how to make resources available to us. You know, like how can we make protective equipment and learn to use things around our house to keep ourselves safe. Because the interesting thing is the controversy around the masks and whether or not people should be wearing them. The CDC is now reconsidering their kind of claim as to whether or not we should be wearing masks in public. And I think that article came out in the Washington Post today or yesterday, where the CDC is actually considering encouraging people to wear them. And again, you know, just like with everything that we're doing that's hygiene oriented right now, even when you wear a mask, there's hygiene that is very much necessary when you don it and when you doff it. And that's the term that we use in the hospital. Because if you do not put it on correctly, you can infect yourself. Because I just spent all that time talking about not touching your face. And when you take it off, you could infect yourself. If you touch the front of the mask, then you've touched all the, you know, all the little particles that are hanging out there. So really thinking about, are my hands clean when I put it on? Are my hands clean when I go near my face again and I take it off? Am I washing it? Am I throwing it away? Do not hang it down by your neck, even though you think it looks so cool when you do that. Don't do it.
Thank you. So Bita, and I think this will be the last couple, just to lay the baseline questions to you folks, and I'm going to encourage folks, if they have questions or comments, please start typing them in the chat room. So as an epidemiologist, or I don't know if I said that correctly, and a public health researcher, let's bring the police state into the equation. And let's talk about, like, there's so much going on. I mean, obviously the prison system, the rate of incarceration, one of the most largest numbers of incarceration per population capita anywhere in the world. We have people in detention centers, children placed and separated from their families. I mean, we can at the coalition, we can talk for N days about the police state and its operation. So in this moment, how do you see the workings of the police state, and what do we see, like, what is our call to action as well around here?
Well, I think that around that question, it's really going to be, well, you on the ground documenting the ways that it's showing up. So you see the technologies and the increase in technologies. From the other side, the way I see that the police state is moving in is going to come a lot around this question of, are we doing enough to what we call flatten this curve, right? So the idea is that is physical distancing being done enough, right? And so the state's going to have to make a determination on whether that is the case or not, right? Are people doing everything that they can to actually follow these orders we put into place? These orders we put into place gently, right? In their eyes, we put them into place gently, right? Two, the other thing is going to be, well, was that enough? Even though they did this, was it enough in order to prevent what we call this huge rate of people going into the hospitals? The hospitals have put themselves, like, for me, there's two parts of this conversation. It's the way that the state is like talking to us. We got Trump saying, hey, the economy is suffering. The economy has a health. What about the economy's health? And then you have other people coming around saying, you know what, like, the health of the economy is kind of important because I'm a person, I'm in the system, and I also need to make money, right? Something that's very real. But then you see the way that the economy's health is being positioned. And then on the other hand, you see the way that the health of the healthcare workers is being positioned, right? And the fact that they are in the center of where people are going to come, right? Once they are sick. So I think that in these two places where we have this balance, everything that we're doing here in the middle, right, in terms of how the police state is going to operate, it's really going to depend on, are we doing enough of what they're telling us to do? And even if we do it that way, is it working? Right? Because there is this added pressure to get this thing done so that we can restart the economy. But then there also is the ways that, when we talk about what we're experiencing right now, a lot has happened post 9/11, especially around like FEMA, right? With Department of Homeland Security, in terms of how then what we do and the policies we enact, and then the resources we have, right? How they will be distributed, and what are the measures that we're going to enforce them, right? And I know that this is something I think you're going to get at the second webinar, like thinking about like those ideas, FEMA, DHS, and how it's connected to the surveillance police state. But this issue that we're talking about right here in public health, this programs and policies were being put into place regarding this in 2000, pre-September 11th. So how we're thinking about what we need to do and how to go about doing it is all coming back to, who do we need to protect? Do we think that we're going to have enough? And who are we going to determine is going to get this stuff or not? I think connected to what you're talking about here in the police state, which I know folks are having this conversation, but bringing the two together, is like eerie feelings we have around some sort of racial logic, like a eugenics that's coming up. If we were to think about what Jamie is saying, that, it looks like it's, that some pressure is being relieved in the California context from the hospitals, or things are not happening as fast in all the hospitals as they predicted, right? But if we think about the situation that is trying to be prevented here, of a huge push inside these hospitals, with the hospitals having to make decisions of like, I got 5 people that need a ventilator and I only one person that can give it, or the hospitals having to make the decision of, I only have 1 person who can actually do it, and I have like 5 people who need it, right? Because it's a workforce that actually, that's trained on that ventilator. When you think about that and you think about all the disasters that are there, like we saw in Italy, a protocol is going to have to come into place on like who of the 5 is going to get that, right? And the decision on who of that 5 is going to get that is going to come down to who are we? I mean, as crude as it is, I think it's important to talk about it in its crudest ways, right? Who do we think is valuable enough to keep alive? Now we will put attached to that, who do we think has the highest chance of living, right? We'll talk about it that way. Who do we think has the highest chance of living? But who we think has the highest chance of living, all that goes into that has been built on all the things that you guys have been organizing against here when you're talking about the police state. Whose life do you think is worthy, right, of protecting, and who do you think is disposable? So all that conversation, that kind of that framework, those ideas, right, that racial ideology, that is going to be showing up into that scenario. So getting to your question of like, Hamid, like, how do I see the police state operating? It's both operating in these ways that are a bit unknown, because we are a little bit unknown about the science, you know, it's not so much that we're unknown about the science, is that we really only know certain things right now, right? As we wait to see, as things progress and they change. But then also on the other end, like the ideologies that are foundational to the police state, how are they also showing up here in this pandemic?
Great, thank you. And then lastly, Jamie, just as we go and I think this would be, I'm going to raise this question with you to get the folks involved. That as a frontline care provider, but somebody who's also been very, very, very actively, organizing against the national security police state as well. And somebody who was also involved with Occupy, but one of the key leaders and now at the Stop LAPD Spying Coalition over the last 9 years or so. I mean, how do you see this moment as a way of building solidarity? How do you see this in the broader context of movement building?
Mm-hmm.
And I'm going to also, in the meantime, ask folks that there's a raise your hand feature in there too. So if folks want to just either send a message or raise your hand, then we can at least start unmuting folks and then start getting this interactive conversation after this piece that Jamie is going to talk about.
So again, I think I'm going to go back to just borrowing language again from the coalition of not a moment in time, and just thinking about the conditions of what we think will happen in the hospital when the surge comes, when, you know, all the units are filled and we're actually using the boats that are the ships that are, you know, docked here in the port, is what's always been happening, you know. And that kind of sentiment will perpetuate itself, and it'll just be accelerated exponentially, right? Because I think that, you know, to take it out of the context of the hospital, when we think about social distancing, and I haven't been able to do too much research, but I saw posted on Twitter yesterday, there was actual LAPD kind of breaking up this party that was happening in a Black community. And there were, I guess it was a 1-year-old's birthday party, people were gathered. And you see, just like you see the line office, you know, the officers in a line pushing forward, almost like in riot formation, separating the people, yanking on people, pulling people, almost like, you know, you're in the, it's just not new, right? So the racialized tensions and the racialized policing that will happen, where you have people who, when I was just before the beaches were closed in Long Beach, gathering and sitting on the beaches and hanging out, and everybody's there, and I'm like not wanting to walk down there, is happening amongst the white community. But then you go into a Black community, you see it, and the next thing you know, you see 25, 50 police officers, you know, all of a sudden with batons out, pushing people away, separating people. So it's not the way that the policing will happen, and in this kind of context of social distancing, I think we'll see the same reflection of how policing has always happened. The things that we'll see in the hospital, I think, will be similar to things that I've always seen in the hospital. We have this interesting phrase that I tend to always try to clarify with medical teams when they say they're going to return someone to their prior living situation. It's AKA you're going to kick them back to the streets.
Right.
So please, and then, and so I think that what we're going to see play out, like in the scenarios that Bita has laid out, is just something that we should not be like, we know how it's going to play out. And that's why it's concerning, even in the beginning of this conversation, to hear that union mission has now been hit. Because if it's just one or two there, then we know it's a cascading effect. And I have to say that a friend who's an infectious disease doctor did tell me that we are going to be very concerned if and how fast it starts spreading in the jails and amongst the community that doesn't have houses. And that is going to be kind of the telltale sign is how well we're going to actually do through this. And so again, the solutions have always been the same: housing, medical care, food, jobs. They just haven't changed. And I think this is a conversation that Bita, Hamid, and myself were having. And so I think, if we get our framing right, we'll see what the solidarity is that those call outs need to be there just as they were during Occupy, as they were in the Black Lives Matters movement. This needs to be, again, another call for us to raise up those issues and build that solidarity. But again, what's interesting is when it comes down to those vulnerable communities, when we talk about, violence against the Black community, when we talk about, unresourced people in the hospital who don't have access to insurance and things like that, this is where the state wants us to kind of go to sleep. And, that's what made the Occupy movement so interesting at the end, is once it became about unhoused people and about police brutality, it fell apart. Right? The infiltration, all that, because they didn't want those concerns to be out there, to be mainstream. So we got to think about it right now, is that once we start to raise the alarm that, caring for this community will mean caring for ourselves, will mean that our life will be preserved. I'm wondering how the state will respond.
Great, thank you. So, Carrie, were you raising your hand? I just saw you. Oh, okay. All right. Okay. All right, folks. So this is the time that, let's just, if folks are wanting to chime in, we can unmute you. And just some folks have left some stuff as well. And I know there's a comment from Stephen that it's always suspect when the police department is a key messenger. Which is something like, Orange County Sheriff's Department is acting as a point of contact rather than public health. So, just for that in mind, Bita, do you have any comments? What is it about? Because it's this public safety, public health, and the PD becomes our main point of contact.
I mean, it goes back to part of what also I know is part of the solidarity conversation with the healthcare workforce, right? As an epidemiologist, I'm a type of health professional, right? But I'm not a part of the healthcare delivery workforce. And so when I see something like this, it just once again brings to so many of our, my colleagues' attention that public health should be this. And if we want to call safety something, it should be this. And the healthcare workforce should be this, right? And for those of you who can't see on the phone, sorry, what I'm saying is that the public health should be the big picture and safety, whatever we're going to call safety, and also then delivery and treatment, managing the hospitals, the healthcare workforce. These should be components of it. So when you see that the sheriff is delivering the message, it's for me, that's symbolically very clear. Public health is working for us. We are not one part of public health that might be useful here at this time. Right? And so then, I think that comment right there, that observation in the chat, kind of summarizes so much.
Absolutely. Okay. All right, cool. So let me just see if folks are asking questions or any comments. I don't see any arms or hand raised or comments going in there. Maybe what I'll do is just call on some folks as to, okay, here we go. So there is a comment. Um, from Harry that I wonder how we as abolitionists talk about jails, prisons, departments of corrections, not detention facilities so far, selectively release people from prison jail during the pandemic and make the release cages permanent. So Harry, I'm going to just go ahead and unmute you. Excuse me. So go ahead and Harry, if you want to unmute yourself. Yeah, you're unmuted. So go ahead.
Can you hear me?
Yes, absolutely.
Oh, hi. Glad to see you all. Yeah, I mean, my question is just, there are like stories, at least in the news. I haven't kept up in LA about how jails and prisons during the pandemic have been identifying jails and prisons as places in which coronavirus or COVID can spread, and selectively releasing certain kinds of people who are incarcerated, usually what they think or call low-risk people or incarcerated people. And I wonder, you know, how we as abolitionists, like, you know, mobilize making release permanent, and you know that jails are a more endemic public health problem, if that question makes sense. Like, I don't know what you all think about that.
So we actually had it was a pretty, it was a good conversation as well at the coalition too, because obviously there's several letters from different groups going to the sheriff's department and the county board of supervisors. The same thing was happening with the city government. And I think there was this whole almost like separation. And it was a struggle, absolutely a struggle about, like, you know, releasing folks with low level offenses and, you know, so what happens to the others. So it's kind of like falling back into that good immigrant, bad immigrant kind of dichotomy that we have always struggled with. So I think your question is absolutely, I mean, central as abolitionists, as folks who don't work towards reform, to dismantle that. So I think it'll be a great strategy conversation too. And Shakir, I know that you've been on the front lines, and particularly with the Bail Project and dealing with a whole bunch of folks who are in prison. Any thoughts and comments about that?
Yeah, no, it's a big question, and yeah, we're seeing kind of the demands for, okay, let's like find the categories of people that we feel comfortable pushing for, and people are doing these trade-offs and kind of calculating it in that way. I think the kind of messaging and the way to think about it ultimately is that it's not just a question of, okay, these people are like, we have to look at the level of risk from the coronavirus and then decide, okay, these people, it's worth kind of punishing them more, or even instead of those trade-offs. The point is just that jails and prisons are always sources of death, and are always circulating death, and are always kind of regulating death, and they're killing people, and that is just in the same way with coronavirus, where part of the argument is that we need people out of jails because jails are going to be sources that are going to be places, hotspots that spread the virus across communities no matter what. That the health of jails is going to be critical to the health of the community, because that's so many people are concentrated there, and so many people are denied access to resources there, that is going to then spread. And it's the same at all times, that the more people are in our jails, the less safe we are, the less healthy we are as a society, because just so much suffering is kind of passing through the mechanism of jails. But yeah, that's me. That's not really a public health answer. Jamie or Bita, if you want to take that on too.
You know, Harry is someone that we do research together on criminalization and public health. And I just want to give a shout out to Harry, as their research was really, you know, has played a really key role in some of the stuff we're doing, Jamie and Hamid, around thinking through surveillance and public health. For me, like, there's so much tension in this, because, you know, having done work on criminalization health before we pushed for getting people's attention to brutality or incarceration as a public health crisis, there was this tension at that time there that if we don't get changes based on morality, we're always going to have to make a health argument. And that the health argument can only take you so far. And so right here, we see the same thing. That at one point we are, as organizers, wanting to leverage public health because we also want its workforce to come on board. And unfortunately, its workforce in its own kind of like mindset can justify being involved in politics if it sees it as connected to health, versus coming from the place of like, our political health is our health. So what is the politics, right? What is that larger politics? So it's because we can't come to this way. I feel like that's here part of your question, Harry, as well, that like right now we're trying to say, well, these people should get out because these people might die. And then getting back to your point, if the suffering right now is invisible, I guess it's not suffering, right? Which I know we all here have a problem with. And that's like kind of the larger question here in organizing, because we're trying to also build collaborations, right? And, and part of that collaborative part that's essential to organizing means pulling people in. And when it comes to the solidarity with the health and healthcare workforce, we're trying to pull them in through the angle of health. Mm-hmm. And versus us also putting pressure on them to be like, you have to reimagine society in a different way, and that you are one part of it, not that this is your issue.
Mm-hmm. Thank you. Amy, I know you had a question, so if you want to unmute yourself, I think you should be unmuted. Yeah, hold on a second. Where did you go, Amy? I'm sorry. Oh, there you are.
Thank you. So I think it happens unmuting yourself, and then the host has to unmute you.
Yeah.
So I want to thank everybody for being here, especially the presenters. I have a question that's not really a discussion question. It's just like, I have like surgical masks, like probably 50 or so that my dad dropped off and somehow got a hold of. And I just wanted to know if those masks are useful to healthcare workers, because I'm also hearing about other projects that are making cloth masks for healthcare workers and other frontline workers. But I just wanted to hear from you, Jamie, about what healthcare workers need and can use in hospitals.
Mm-hmm. Well, so again, like I was saying, as far as, what we have access to, we do have access to PPE. How much is different, varies per hospital. I do have my own cloth masks that I wear to work because of, and I switch them out probably, like I bring in 2 to 3 for a shift, and my shifts are 12.5 hours, and I switch them out through the day. There is no official okay to use them. In fact, I believe that we are being told not to use them. So as far as what healthcare providers need is basically, again, that kind of, and I think this, if to speak about it, and one thing we didn't ask comment on this call is if there's any reporters on this in this call. So if that's just something I can request, maybe at a certain point in time, if we can find out if there's reporters on the call, on this Zoom call. But to put it into like a different context, I think in regards to like solidarity and what we can be doing as mutual aid, for a quantity as low as 50, I would definitely, encourage folks that are like going out into the community, high risk folks that have comorbidities, that are elderly, to be using masks when they're in public. I use a mask when I go to the grocery store. I use a mask when I go on a walk. I have good mask hygiene. Again, I'll stress that. But as far as what healthcare workers need right now is they need kind of like that commitment to understanding why we're socially distancing. We need that commitment to folks, making sure like governors and city officials and, you know, even the president is understanding that PPE is necessary for us to continue to do our job, that not only do we need it right now, but if we start to not have access to it, you will see us start to become infected, and you'll see us be unable to do our job. So I think what is necessary is for the community to know that I need to be sure that my city official and that my governor and that even, you know, are creating those resources and making sure those resources are being made available to healthcare workers. And I think that's what we need right now, is to make sure that the community is kind of rallying to realize that, yes, there are people that are on the front lines that need the N95s, that need the surgical masks, that need the goggles, that need the appropriate gowns in order to continue to need the gloves in order to continue to do their work. And in an ideal situation, we would be able to have access to enough of it so that it's not shared, so that it's not overused. And whether that's happening in hospitals, I won't talk about, but that's what we need to do our job. And so again, and I really like how Bita kind of drew out like this larger circle of public health, and how we think about healthcare workers being a component of that, you know, and however safety is a component of that. So how do we keep that component safe so that the larger public health issues can be dealt with? So yeah, so that's kind of my, like, I guess, request when I think about solidarity work, is to making sure that we keep that up. But I would encourage, if you are making masks, to share them with mutual aid. Anybody that's involved in mutual aid needs to learn how to be donning and doffing masks, needs to learn how to use them when there are, especially if they're engaging with someone who is sick and who is not sick enough to be in a hospital, needs to understand good mask hygiene, needs to understand how to drop off, you know, groceries, how to do these check-ins, and so that's kind of part of what I'm interested in right now, is kind of looking at what are the scenarios that people are facing in the community that they have questions about, you know, because I get concerned when I hear like what different people are doing, and if they are, you know, having access to the right resources to create those plans that they need, whether they are, you know, talking about, you know, work that the city hall is pushing, whether they're talking about their own nonprofit and how they're keeping safe, whether they are, you know, developing mutual aid programs, like what is happening out there that people have questions about that we can, you know, try to answer here as well.
So which really opens up the question, because we would love to hear, you know, just what are some of the, here, Amy, I just went in and unmuted you. Do you have a follow-up?
Yeah, and I think that makes it a little bit more clear. Also, somebody directly messaged me, and I'll pass the masks along to them. But definitely, yeah, I've been looking at a lot of like the queer care safety protocols that Ground Game Mutual Aid has been using, and I can share that safety zine for people to reference. They're doing a good job, I think, of implementing just like proper sanitation, like when they're doing drop-offs of groceries or supplies. They're making sure that there's layers of like bags. The outside one is like not sanitary, and there's 2 other layers inside, whereas some other mutual aid is not practicing sanitation to that level, and that is troubling. Yeah, but I can share that zine in the chat. I think I have a link.
Great. And we will also, in the process of creating an outreach zine as well. So in a few minutes, we're probably going to just pull that up and see if Nadia is available to talk about it. So a comment that when keeping track of daily numbers, I also reflect on other causes of death and wonder if diseases like heart disease, cancers, etc., have similar numbers. Are COVID-19 numbers so unique? Can either one of you address that?
You know, when I'm looking, like when I'm reading this question from Sarah, what I'm seeing here is that, no, they're not. And if we do what we need to do, then they won't be there, and that would be a victory for some, it might be like, well, see, it wasn't a big deal, but it's like, but if we did what we did and that didn't happen, that's that's good, right? It didn't get there. It can get there though. And that's what the fear is. It could get there. And in fact, it could surpass it, right? And then when you think about those daily numbers are numbers that are, when we put them in aggregate, produced over a year. So it's in the amount of time frame that we had COVID. And then what were the consequences of it added with all of it. I think part of the problem here is that we also go after the virus. We think we have to know what's going on with the virus. The virus is everything, and the virus is what's shaping. It's obvious an unhealthy society that right now is having the situation with the virus, right? That's what's going on. And so that when you think about COVID in total, it's not going to just be the COVID numbers. It's going to be all those other numbers you're talking about of other causes of death, the heart disease, the cancers, all of this together, and who died the most, right? Like that's what's going to be like, you know, it's kind of that endpoint. And the fact that these other diseases that are here, that are happening, are technically what we're saying are pre-existing conditions, which then made the COVID so, you know, so somebody's getting counted in multiple places. If they, you know, at both as somebody who has heart disease and then also somebody, right, who would have been impacted by COVID. Yeah, so when I see that, that's what I'm, you know, that's what I'm thinking of. And which is why I feel as from an organizing perspective, like just as if we you know, we're concerned about how is it that if we put public health at the front and we run after public health, we are tactically using COVID because that scares kind of like the larger white society, right? The COVID is now the other, right? And we are all the other. So others with COVID are even more scary, right? In all of this. But it's not only like the COVID and we're using it because we're understanding, you know, we have to make arguments that work within their fear model. But that we also need to push them to be like, it's about all of this together. It's about what you've produced. You're scrambling to figure out what to do with people who are homeless because you allowed for them to be unhoused. You know, like that is part of your problem here, right? And then also at the end of it, when this is done, the way that poverty and all this stuff is connected, you know, poverty, race, and place. And of course, this is also extremely gendered. Who are the workers right now that are also very much at risk, whether it's a healthcare workforce that is, you know, nursing, or whether it's a healthcare workforce in the nursing homes, the ones who are also part of the cleaning, right, crew, which is essential to public health right now. Those who are cleaning, right, are part of our healthcare workforce. Like when you think about all that and in all of it, it's when you at the end, it's that the ways that poverty put us at risk before, race put us at risk before, place put us at risk before, what are they going to do when this is done, right? Mm-hmm. What's it going to look like? So I would almost push us to not make this argument, to try to say, hey, it's not just about COVID, because look at the impact. We have to push them to see this as a collateral impact, the total impact.
Mm-hmm. 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 Jamie, you have any follow-up to that?
No, but I wanted to take a stab at the second part of the question.
Yeah, go ahead.
There was a number 2 there where
as an average citizen, I feel concerned about misdemeanors being passed out by state regulating bodily movement. This sets a dangerous precedent to me. To what extent should we be concerned organizing around this? Mm-hmm.
So I think that, again, I'm going to go and talk about how it's not a moment in time, but a continuation of history, right? And whose bodies have always been policed if gathered in 1 or 2 or 3 or 4 or 5, as you know, Black and brown bodies have always been criminalized. My brother tells me stories of when he was young and just a group of 5 of them hanging out in the park, and the next thing you know, all t-shirts are up, they're up against the wall, pictures are being taken because the assumption of gang membership is there. So I think that we need to kind of think again about how the state has always been doing that to our movement, to our ability to move, especially impacted communities, especially if you are Black, queer, brown, youth. And so, so we start from that baseline with the expectation that that's how the state will always act, even in a pandemic, where us being separated is actually beneficial to us, will preserve our life. But yes, who they're going to police, again, is being played out, and stories are now starting to surface that, of course, the Black community, as opposed to white communities who are gathering and, you know, still, you know, at one point by the beaches, going on walks up, up into canyons, not being aggressively addressed, as opposed to other folks in other situations, being definitely very much surveilled and aggressively engaged with. So I think what we need to do in thinking about this is really be framing it in the sense that this is what they're going to kind of, how do you say, like, this is the opportunity for them to continue down that path and maybe attempt to solidify things. And that's why these relationships with folks like Bita and folks that are looking at, are the solutions of, of physical distancing, of washing our hands, of, not touching our face, wearing masks, is that all helping to reduce the load on the healthcare community so that we can kind of start to return back to a normal, an existence that we had prior to this. But my point being is that we always have to be thinking about how we are kind of coming at that question, so that when the attempts to enforce that, and they're talking now, and the way they're speaking about it is like per county, per state, how they're going to look at how different groups are doing, and that's going to go nowhere if they don't have massive amounts of testing for them to even see how communities are responding to physical distancing practices. I do think we need to be like boots on the ground, kind of documenting, who is it that they're policing and who is it that they are giving these misdemeanor tickets to, so that again, we can, and being the Stop LAPD Spying Coalition, just kind of again show them like, this is what we're telling you, even in time of pandemic, your rate of misdemeanor filings, and I will just, make the assumption, is predominantly going to be the Black community. Is not going to be the white community that at certain points feels like they're completely immune to this. Because the interesting thing too, when I was looking at, if you go to that initial link that I showed for LA County, it was the very affluent communities that had the high numbers of COVID-19 cases. And I was like kind of shocked a little bit, because I'm like, what is going on here? And we got to think about a lot of people who have this assumption to movement, to access, to do whatever the hell they want, when they want, are probably under the most duress at this time, because they didn't want to give that up, because they've never had to. They never even had to think about it. When I went for walks, and I live in Long Beach, I would attempt to go down near the streets by the beach to just do a walk, but so many people were out. I went further up into North Long Beach, and everybody was almost like doing exactly what they needed to do. Inside the houses, streets were clear. I could, do a walk. I wouldn't have to worry about getting into big clumps of people. So anyway, so I'll stop there. But I think that, the framing of how we go about it and boots on the ground, documenting who is actually being ticketed will, kind of, again, just reiterate the case that this is not a moment in time of who's going to be policed.
Great. So we also have our comrades from other parts of the country as well. And Andrea, and I know the folks have been having conversations similarly in other places around organizing and what does this moment look like. So Andrea, do you want to share with us briefly as to what was the conversation today?
The conversation today was basically looking at how public health orders are being enforced currently, what the kinds of penalties are under public health laws or in California under your emergency services laws, and then also how police are just using obstructing government administration, disorderly conduct, the same crap, right? To break up the groups of people of color in parks, et cetera. So how patterns are looking very similar, how the same groups are being targeted, people who in the sex trade who are continuing to work because they're not benefiting from the relief packages are being charged, people who are houseless, disabled people who are unable to comply with the orders for a number of reasons, or the whole process is not accessible, et cetera. So we looked at all the patterns you're describing and how they're playing out, and looked around the world to see how things are playing out and to see how they might come here in terms of GPS tracking and surveillance and criminalization based on that. And then some of the organizing that we talked about was tracking arrest patterns and using that both to rapid response mobilize to support people to try and keep them from going into jails, but then also to track the patterns and organize around them. And there's some guidances that have been put out for law enforcement, basically saying law enforcement should also be social distancing. They should be staying at home and they are vectors of COVID, and saying that arrest should just never be an option because putting someone in a jail right now is a death sentence potentially, and that can't be an option for loitering or disobeying an order supposedly in the name of protecting someone. If you're arresting them because they're supposedly placing themselves and others at risk, and then you put them in a jail, well, you've just created the problem that you're supposedly fixing, which we know is exactly what the police do. So so folks want to track arrests, if folks want to track the different orders that are being put in place and how they're used, if folks want to be part of thinking of other ways to support our communities around these kinds of orders, that's half of the call. We really started trying to imagine how can we support people individually, collectively, as our existing networks, in our mutual aid networks, in following the guidances so that we can get to the place where, because what I'm really learning from this call is this question of like, what's the driver of enforcement? And if we can secure, like get the cops out of the picture and keep ourselves safe without them, then as in any other situation, any other moment, that's going to reduce police violence and enforcement.
So Andrea, what are you doing Thursday at 6 p.m. Pacific time?
I don't know. What am I doing?
Well, you're going to be on our webinar part 2.
Great.
And I'm saying that, folks, because I know Andrea as a comrade, Andrea as a friend, Andrea is this amazing organizer, scholar, and writer, just did some brilliant work around, particularly around gender and sexuality and surveillance. So because our part 2 was on around policing, and we're also going to have Kath Roger from National Lawyers Guild on this too. We'll be focusing around that. So now you have been booked from, well, not in the police, talk about a Freudian slip of booking.
Yes. No, thank goodness I haven't been booked, but I appreciate it. I'd already signed up for the webinar.
Exactly.
So I'm happy to be
so you volunteer. You have been signed up for the webinar, and I'll follow up with you if you want to text me your info, like at 562-230-4578. Then I can follow up and give you some more details as well. So it's from 6 to 8 Pacific time on Thursday.
Great.
Okay.
Thank you.
I want to add something to what Andrea said at the end that is a point that I really want to make sure we make before the call ends. And Hamida and Jamie, I know this is something we talked about in our conversation, which is the idea of, if there was a take-home message from this, it would be to keep ourselves safe. The same ways that we talked about public health being a tool of the state, there's no reason why its science can be a tool for us as we organize. Part of all of this has been to look around the world and think about different ways of doing it. And obviously Cuba has stood out for so many reasons, right? As being not only sending people to other countries, but at the same time, when that boat was floating around, right? And nobody would let them dock, that they took them on, they treated them, right? And in fact, sending workers to the country of which the tourists who came were the reason why the Cubans got the first infections, right? From Italy. So when you see that, then you think about, if for somebody to do that kind of internationalism, to do that kind of solidarity, like what do they think about health? They think about public health the same way that I described it at the very beginning, which is the knowledge and the tool to keep their population healthy though. So part of all of this knowledge and about the ways that we have to build the solidarity between the workforces is that we can also use this knowledge. We also have enough people who have these tools so that we can do this to keep ourselves safe, right? So that we can continue to put pressure and on the system in the ways that we know that we have victories right now, or we have a place where this is a really important moment. So yeah, that part there of what Andrea said of keeping ourselves safe, I feel like, was the beginning, the middle, and the end of this.
Thank you. I also wanted to see if Nadia is around, because wanted to bring in a zine that we are in the process as a resource guide looking to put out. Nadia, are you around? Oh, there you are. Okay. All right, cool. So let me try to, and this is in partnership with the Baby Anarchist, who primarily drew this, and the Palestinian Youth Movement in LA. So let me just go and, okay, Nadia, you are unmuted. Let me go to screen share, and there you go. And if you ask me, I'll just move it up and down. So
Cool. Hey, can everyone hear me?
yeah.
Okay, cool, nice. Hey, Bita, good to see you.
See you too.
Hey, yeah, so this, just want to shout out the group who worked on this zine. It's definitely was a very collaborative effort. And really the goal and purpose of it is one, because a lot of people were reaching out, asking questions around, you know, how are things rolling out? What does this mean for our communities? You know, health related and of course police related as well. And so obviously us being surveillance oriented and really tackling the national security police state, we wanted that to be the focus, but of course still bring in the health elements. And so the goal with this zine is really to start sharing information. It really came as a knowledge exchange, various conversations, reaching out to people. And really in the end, we've decided that this is going to be issue 1 because there are a lot of questions we weren't be able to answer. And we wanted this to serve as a call out to folks to look this over, share with your peoples, your communities. We're gonna have it a printed version as well. Yeah, feel free to scroll down it too. We're gonna have a printed version of this and then also sharing it online. And so the goal is for folks to look it over and see, okay, what are some questions people still have? What are some concerns people still have? What do you want to see in the next issue? How do you want to help? So this really is collective in that sense. And so, so yeah, so if you kind of scroll down, you can see this is like a Dear Reader, just kind of introducing it. And it's several pages, so we'll be sharing it for y'all to kind of read more in detail. But this is kind of, so this actually particular page that Hamid is on was really helping to kind of also connect to this webinar. So what would be great is some of the things that can come out of this webinar and then the next one on April 2nd, right? Yeah. For that to even help inform the upcoming issues. So yeah, feel free to scroll down. So these are just some questions. This is also understanding COVID. We wanted to really, and I believe this might have been said in this webinar, we want to rethink, instead of calling it social distancing, calling it physical distancing, knowing that that is necessary, but the point is not to break up in terms of like our organizing. It just has to shift. You can keep scrolling because I know that one's a little word heavy, and you can see the folks, Baby Anarchist highlighted parts. So for people who don't really want to read as much, at least there's some highlighted images. This is looking at what the point Jamie lifted around Skid Row and unhoused communities always being in a health crisis. Feel free to keep scrolling. And then this is, of course, knowing your fight. So the different pieces around rejecting policing and surveillance, abolishing the power of wealthy elites, and fighting back. We did put some basic health suggestions just around just like washing hands and things folks have generally heard before. So yeah, feel free to go down. This is a little bit of the history. So this is why the series is called Not a Moment in Time, but a continuation of history is something the coalition does frequently say. And so this is just a few brief examples of how crises have been used in the past to expand the police state and the national security police state. So that's that. And again, highlighted pieces for the folks who wouldn't read as much, which is all good too. So this is now entering the resources resistance piece. So just some kind of basic ways to fight back around care, advocacy, exposing, and resisting. So this just kind of lays it out in the big picture, just some ways people can take action and fight back. And then if you wouldn't mind scrolling down more. This is again, so we didn't get to go as much into the youth component in this piece, so we're definitely hoping to really expand on that next time. So feel free, anybody, to send your thoughts, questions, or resources, however you want. But this is just shows that we're thinking about it, we want to build on it. Looking at, just posing the question of how we have a history of taking care of each other. So how are we really tapping into that? And I think that was also discussed in today's webinar as well. And then these are some resources. So LAUSD has 64 resource centers where they are passing out 2 free meals From all the centers I've checked with, they're not asking for proof, and so we felt comfortable sharing these centers. They're giving folks hot meals based on how many children they have. My understanding is that children don't have to be there, but at least for folks to know where there are hot meals. And then these 2 mutual aid documents for people to fill out if they need anything. And then down here, we shared the resource that LA Can has been sharing around their hand washing stations. Now they have maps where you can zoom in and out. And so we just kind of right here focused on the Skid Row area. But if you go to that link, there's much more extensive maps. And also that graphic shows how you can actually build a hand washing station to drop off for folks at LA Can. And then, yeah, this is the last page, basically reminding us that this is a call to action. And so because this is going to be an ongoing series, once we share this out again, please feel free to share and give feedback. And if you want to participate in the process, it's collaborative in that sense. And shout out to Baby Anarchist for some really dope graphics. So yeah, happy if anyone has any questions about that. And again, we will be sharing it hopefully tonight, if not tomorrow.
So thank you, Nadia. That was super helpful. So now I'm going to go ahead and unmute all the participants, everybody there. So if people can mute themselves,
yeah,
if they,
I'll
if
have
they
my
don't
headphones
mind.
on. Like basically, I just be like doing my thing.
Okay, we're hearing a lot of people in the background, so if people don't mind muting themselves. All right.
Well, I figured out that I can use both.
Okay, mute yourself. So maybe we'll just mute them. Okay, so let's see. Who else? Any other questions that we have? I mean, I'm going to try to unmute again and see if people want to chime in.
Offload these guys. They're going to go to Guam.
Okay.
But there's only like 6 ICU beds on Guam.
So that's a whole lot of conversation about Guam going on. So I guess we'll just go ahead and mute ourselves. Okay, so I think there's a question from Dejanay here that any information on COVID-19 screening and tests. Jamie or Bita, do you want to take that? Let me see if I can unmute you, Jamie.
Oh, okay. So, so as far as testing goes right now, I know that testing is still pretty precarious as far as who they're testing and the limit of testing. So the stories that I'm hearing are, for example, I had a coworker whose auntie had the appropriate PPE on, but then was treating a patient who ended up becoming positive, and they did not want to test them only because the appropriate PPE was being worn, but they were able to, because they were a healthcare worker, buy the test for themselves just for peace of mind. I have heard of test clinics that are drive-through ones in the city of LA, and I'm going to attach a link here in just a second so that you can actually type in your zip code to see if there's testing clinics around you. But it still kind of comes down to the matter of whether or not you're symptomatic and if it will change the course of your treatment. And what that means all the time, I don't really know, because the course of the treatment is supportive care unless you need intubation. So I will attach that link, but again, it comes down to the severity of your symptoms and the accessibility of testing, which is still limited. So I'm going to put that link on right now.
Great, great. And then also have a comment from Jonathan as well, that do we know which communities are releasing incarcerated individuals? There's a perspective among some scientists that releasing folks will help prevent some new cases of COVID-19 from occurring. If this does hold to be true, this information could be used to hold communities, police departments that aren't doing so accountable. So Shakir, do we know which, if there are some release going on, is there someone keeping a tab on that?
Yeah, there are a couple of trackers that we can share about that that are measuring who's being released. One thing to keep in mind though is that there's just a lot of different ways that jail populations are falling, and also in a lot of places not falling. There are, as there's less arrests happening, or there's just other ways because of courts slowing down, that people are being released more. So even in places where you might see, like, you might hear, oh, the jail population has fallen 10% in the last month or so, that doesn't necessarily mean that they've been taking a lot of the necessary kind of steps to be releasing more people. And also, it's also worth noting to look at the statistics, and I'll share some of these trackers in the chat, that that most jail systems are operating just beyond capacity normal, like heavily beyond capacity 120, 150. So even the small percentage releases we're seeing are not actually going to do much to prevent the kind of mass spread that might happen in jails.
Great, thank you. And then there's a question, and I think this is a much more, and maybe Chela, if it's okay with you, can I just bring you on, and because I think you're raising a very key question. Chela, can you unmute yourself?
Yes. Hey,
Okay,
everybody.
And Chela, so it was a twofold. I also wanted to check in with you as to what are we hearing out there, particularly in being a resident in Skid Row and being on the front lines of organizing in the trans community. How is that working out and playing out? And then you had this question about pigs giving out tickets as well.
Pigs, yeah. Yeah. So to be honest, I've heard some things. I've heard some rumors around if pigs do stop people, then we are able to say, hey, we're going to do our physical activity, or we're about to exercise. They can't assume that we are like outside meeting. And of course, living in Skid Row, there is a lot of grouping, right? And so like I'm a little bit, just being honest, I'm scared for my neighbors. I'm super scared. To be honest, I haven't left my apartment since I want to say for the last 2 weeks. But 2 nights ago, I ordered food, and I saw my neighbors doing the same old things they do, going outside at 12 o'clock at midnight. And I'm scared. I'm super scared for them. So I'm just wondering, what is our action plan for that? As well as today, so two-part question or two-part point is today is Trans Day of Visibility, right? And I just think of safety for trans women, and particularly trans people in Skid Row and trans folks, in LA County, but specifically in Skid Row, because I know there's a lot of trans women here that are trans women of color that are like doing what they need to do to survive. And I'm super scared for him, real talk. So yeah. Yeah, I'm done. Go ahead.
Okay. No, I was just going to say that Andrea did respond to your question, because it's a very key question, and we'll go more into details around strategy and all on Thursday, because we'll be talking directly about the police. But here, like basically, what Andrea is suggesting is that we should do what we always do while cop watching, like stay at least 6 feet away. Because cops could potentially charge you with attempted assault with a deadly weapon if you come closer. And of course, we've seen that constantly in the row, Chela, about obstruction of government administration as usual. But we need to get the officer's badge and numbers, and it's classic sort of a cop watch situation, and just try to dissuade them, because going into a community, and this has been the assault in Skid Row around attrition through enforcement, where people are not able to pay their tickets, but they just come up with with trying to force people to just leave. And I think, of course, there's going to be the legal justification that, going out for necessary supplies and essential pieces as well. So I think it'd be awesome that this really lays a very good groundwork for our conversation on Thursday. So hopefully this for now is helpful. Thank you, Andrea, for chiming in. Appreciate that. So Chela, was that helpful?
Very helpful. Thank you.
Awesome.
Muting.
Okay. All right. Any other? I know that we had, and thank you, Bita, for posting, putting those links as well. Okay, there was one. Okay, one new message. Let me look at that. Okay. And also, Andrea made a comment that we're looking for cop watching when people are inside as well. So, folks, there's also these links that Jamie and Bita and other folks have put on there as well. Let me just quickly zoom up. Yeah, there was a question about EPI, and I don't know what that EPI question was. Okay, I can't find it right now. I think it was Stephen who had pulled. Yeah, any groups doing their own internal EPI. I'm not quite sure what that means. That's an acronym.
Is it trying to say epi for epidemiology? I don't know. Of course, my mind went there, but.
Well, is there something like doing our own? Oh, hang on, there may be a follow-up. Yes, it is about epidemiology.
Is it? Okay. So what's the question about it? Are any groups doing
their own internal
epi?
Yeah.
I think Jamie talked about this at the very beginning, that like, what do we know, right? Like even I hesitate to say a number, right? Like I almost feel like I want to just speak in general trends, because it is like the same surveillance state that we have like a strong critique of, that's gathering the information and also giving it back to us. So there's all these levels and layers to the numbers and where the numbers are coming from. And then also then what's the process of kind of monitor, there's so much within that. But so I see people wanting to do their own internal epi. I see people, for example, like you'll see a lot of journalists have decided to do case counting themselves from looking through the media, right? That they have at times better numbers that make more sense. And by better, I just mean that seem to make more sense, right? And also are fuller in terms of the picture. But, it will be a little bit more ahead of what's going on, say, in the departments. There was the situation maybe a week back, I don't know time right now, but about a week back, where the CDC had one number, but the WHO had a different number, right? So I think there are multiple places where people are trying to do their own internal epi. What we do know about this is that it spreads from humans to humans. What we do know about it is that we don't have much pre-existing immunity. And the other thing we know about it is that people who will never have symptoms, people who are at the beginning of their symptoms, and people later on are at different points able to give it to somebody else, right? And in different ways. Like this is really what we know. And I think that part of the epi in this whole conversation of data makes us better, data makes us stronger, right? Like as an epidemiologist, I'm saying push back a little bit to that. Yeah, while the numbers will help us do better on the planning for sure, we also have to be thinking about, do we all understand these like 3 basic points of what we do know? And then therefore, what are we going to do about it? Like, what do we want to do about it? What do we think makes sense about it? And then go from there. So I don't know. I hope that I answered that internal epi question.
Most definitely. Most definitely. Jamie, do you have anything to add to that?
Also, I think what's happening too is I spoke of symptoms, and this kind of goes to what Bita was talking about as far as the virus shedding and how are people contracting it, being symptomatic, being asymptomatic, having no symptoms at all to having symptoms. And one of the things that I think is interesting that's coming up that USC Keck just kind of updated folks around was taste and smell being something that is also being kind of identified as a possible symptom. So not being able to smell, not necessarily being congested, but losing the sense of smell So these things are kind of, as cases come in, and unfortunately, as more cases grow, epidemiologists, and doctors are being able to kind of figure out what those other symptoms are that people who are not, having the full-blown COVID-19 disease showing, and that's something for us to kind of stay up on as well, because that will help us get to know our bodies better and get to know symptoms better. And one thing as a nurse that I find very interesting is how many people don't know their bodies. You ask them what's going on, and they don't know what's going on. So I think part of, getting familiar with what is a fever, how does a fever feel, what is a dry cough, what is body aches, what is your sense of smell right now, what is your sense of taste, is your body changing, because then I was reading also how diarrhea is becoming a possible factor as well, and that was in that same report I read. So I think one of the things that's very key as a nurse and someone that walks into a room right away and someone says, oh, I have this ache, my first question always is it new? Is it something that you've been experiencing previously? Have you had it 2-3 days? Did you have it before you came into the hospital? So I think one of the things as we're kind of building a collective resistance to COVID-19 is really being very familiar with what your baseline is. Like, what is your baseline feeling, in your body? Like, have you had a dry cough? How long have you had it for? Does your body temperature normally run at 98.9 on a regular? And then tomorrow, did you notice all of a sudden, you're at 100 and, you don't quite have a fever, but your body's like a little bit hotter than its average. So really understanding your baseline kind of mode is really important right now for you to identify if you're getting sick, right? And the thing is there's a shift in your body. Is your body doing something different now? And keep track of that, because those are the questions we're going to ask you when you come in. And then that's how we build a collective, collective power and understanding of how this virus is impacting each of us in these maybe ways that are not as prevalent. And that was, again, I'll go back to the case of my coworker whose auntie was doing an echocardiogram, which is like, looking at the rhythm of the heart and checking the rate of the heart. And they put these little wires on you. And the person came in not having taste, and then having chest pain, and then later diagnosed with COVID, right? So was this a shift in their body? Had something new happened? And these are the things that I think we need to be thinking about right now as we are trying to figure out, am I getting sick or am I not? Is something different happening in my body than was there last week or 3 days ago? You're on mute, Hamid. You're on mute, Hamid.
Sorry for that. So there's a question here from Chella for you, Jamie, that I get sick often. If I do get it, I have diabetes. Does that mean I might die? Chella, love you.
So I think that one of the things that that we need to kind of ground ourselves in right now is that we are all very scared, right? We're all very scared of contracting sickness, whatever it is. I mean, it used to be cancer was what most people were concerned about prior to COVID. And I think that, again, with having comorbidities, yes, it's very important that you are being very aware and staying in communication with someone. And Chala, we're very close, that someone can be me, that we are monitoring where you're at baseline. Has something changed? Has something shifted? Now, the extent of the illness, yes, there are claims and there are studies that say hypertension, diabetes, cardiac issues all make people struggle through, if they contract COVID-19, more difficult. Can I predict? Because I just saw, and everybody's been saying this has been an illness just for the elderly, right? And that's what made everybody go out for spring break and do all these kind of ridiculous things, because all these young people thought they couldn't get it, which is what we're seeing right now in the county of LA that it is a lot of young people that are getting it. They're in fact getting it. People that are in their 30s to I think 50s are getting it at the same rate that people are in their 50s to 70s. So, and then another case I saw that a woman who was actually alive during the Spanish flu, 1918, that everybody's been talking about, just recovered from COVID-19, right? And I think this was a woman, I can't remember where she was at, but I quickly saw it on social media. So this is someone that's in a high risk age group who recovers, right? As opposed to following the same line of being the person that's most vulnerable, where then you have youth who are thinking they're completely not high risk, who are now contracting it, who are actually getting it and then dying. So, we've had our first youth death and our first baby death in the county. So again, like Bita was saying, we can throw all these numbers and probabilities, but I think what we have to ground in is building those mutual aid networks, Chella, and making sure that if there is a shift in your body at all, that you are staying in touch with your mutual aid phone tree, and that folks are, keeping track and keeping tabs on you. And I can't say that anything is a for sure that's going to happen.
In the last couple of minutes, just want to quickly read a comment as well from Redefined, that just an observation on how staying 6 feet away and how it is used to police and dismantle organizing, as we see Amazon fire strike organizers for promoting gatherings. So it's used as a tool from the state as a reason to arrest folks, using distancing as a weapon, all the way to union busting and the continuation of villainizing organizers and the most vulnerable, which is ever most important to note as we continue organizing in new ways, such as car protests, and continue coming up with new strategies. And then Andrea responded to that yes, an Amazon worker was fired for breaking quarantine rules for walking out here in Staten Island in New York. So these are real things that are happening. So in the last couple minutes, just Bita and Jamie, if you could, any closing comments. Bita, just anything that, both from your vantage point, we didn't get a whole lot of chance to talk about best practices for organizers in movement building. Like, what are some of the key things that we ourselves should also be, because, there's also the reality that, quite frankly, there are no martyrs. They're just numbers. There are casualties as well. So, and that's exactly what they want us to do by creating these distances, but also kind of disrupting our organizing too. But people doing mutual aid, people just out there on front lines, what are some of the couple, 2 or 3 best practices that you all both can share? So Bita, do you want to go first?
Well, to this point here that was brought up by Redefined, and then Andrea gave supporting evidence of it happening right now. This is kind of how we came together, was around the idea that what were going to be the implications of how public health was going to organize, and like public health theory, right, and strategies was going to be used, right, in this way. And when you brought up 1918, if we talk about cholera, if we talk about TB, we go back to like the 500-year use of these things to protect one group from another group, right? And then also the ways that these things are weaponized in order to kill any sort of organizing, any sort of resistance, right? We have so much historical evidence of this that to not think about this means that we're completely naive, which we are not, right? This is why we're having this conversation right here. And so the more we can continue to document this stuff, then on the other hand, if we're going to be saying we're going to make a public health argument, this gets to your point, Hamid, about organizing, then we have to say the public health argument is that when workers are organizing for their rights, for their occupational health, because it's directly connected to them being vulnerable to this disease, right? This virus, right? Like if you so care about the virus, right? This thing that exists, if you care about it, then this is also part of that public health conversation, And so this is, I think this we have to make it very clear that organizing, resisting, striking is also a public health tool. It's a tool in order to get the best, to protect your own health. And so what is going to be the balance between that and these policies? And at the very least, push them, right, to then have to respond to that. While we strategize, right, we continue to strategize. In terms of last points, I seem to think like in these days of like whatever is happening, that it's like some of the basics become the most important. which is around, and like, and Jamie, you were talking about it around fever. I was talking to a medical officer of a clinic, a community clinic in the area, and when we asked her, what is it that you want your patients to know, she was saying something very similar. We want them to know what a fever is. We want them to know like how to dose that fever. A lot of the places where we see the best kind of organizing and thinking around how people can take control of their own health, right? Of people's health, to make this knowledge more democratic, is in the spaces where we've talked about decolonizing medicine, decolonizing science. And we cannot let that part fall to the sidelines when we're talking about COVID, just because the healthcare professionals have put themselves in the front. Because it's been those places where we've also been talking about why it's important for me to think about ways that are inexpensive, non-biomedical, that are accessible, that build our literacy of the body, that build our understandings of the intuitive parts of ourselves, which are so crucial here, Jamie. When you're telling somebody to know when they're out of their baseline, they have to have been thinking about their baseline. It's not like this model of healthcare has ever gotten us to think about that. Like, where have been the places where we've developed the skill set and the tools and the resources for people to think about that? I want to make sure that we're, that we're not dropping that just because all of a sudden we have, Dr. Fauci or whoever, like talking about some other part of it. And then also in the solidarity for that workforce, because we were talking about it being whatever, is that we're also at an important part here in organizing where we can put pressure to say this healthcare workforce, how it has been professionalized does not work for us. Because of how it has been structured, we don't have enough of us. We don't have those who have come from communities and experiences that know how to then treat us. We don't even have people from there, I'm generalizing, who want to live amongst us. So come on, like if this is the case, then we're also having to think about what do we want that healthcare population to look like that we want to be in solidarity with. Because then maybe it wouldn't be a situation, and I mean this sarcastically, where Jamie is reading articles that say, if I say something, I'm going to get fired. Right, that right there doesn't help any of us. So what is the thinking in that structure that puts that out there, right? And that creates these problems. So then the other part of the solidarity being that we also have to think about how we want to transform that workforce, because we are in this COVID situation, all getting a quick like, oh wow, who are they? What are they doing? What are they saying? And I don't mean like we haven't been already thinking about that, but that's also a place of which we have to we have to be organizing and focusing.
Great, thank you, Bita. The last couple minute that we have, it's 8 o'clock. Jamie, any quick closing comment from you?
Yeah, no, I think I'll just keep it real brief, but I just want folks to, again, like with what Bita was saying, take inventory of your body, take inventory of where you're at right now. And know when those shifts happen, make sure you're a part of a mutual aid tree, phone tree, because even if as organizers we're off organizing, everybody for everybody else, but make sure you're organizing for your own safety as well. Look into, these links, share them with people who don't have access to the links. And I think, again, just being so much of, an organizer that came out of the Occupy movement, I think that I was helping to organize the medical tent there. And really when it became, again, about Skid Row, when it became about police brutality, everybody, the Occupy wanted to shift its focus, right? Because it was so economically driven. And I think right now is a time for us to, again, to demonstrate, the solidarity with folks who don't have homes, solidarity with those who feel the boot of police brutality. And, and then reclaiming these spaces that are supposed to be ours, like healthcare centers, like hospitals, and really inviting workers into having those conversations. Because I have to admit, this was such an odd space for me to be in, because I have not, since Occupy, been in a space where I can speak about what it is to be a nurse in general. And it has been great because there's so much change that needs to happen just in my everyday experience of seeing the different people that are healthcare providers, their different thoughts and perspectives. This is a space that needs to be organized, a space that needs to be infiltrated, a space that needs to be reclaimed. So stay healthy, check in with each other, and, yeah.
Great, thank you. And just a quick another comment, Nadia, that Amy said that could we add this info, tracking shifts in your body, the COVID symptoms to the zine. Or, I mean, of course, it's a living document, so, this is something, but just to kind of keep that in thing as well. So we're going to close out. Shakir, do you have any last comment?
No, I don't have anything. Just no. Thanks for joining, and I think hopefully we're trying to get the zine out either today or tomorrow, very soon.
Okay. Hey, Jesus, I know you had your hand up, so we're trying to close it out. If you can really, really quickly, if you have to make a comment, please go ahead.
Yeah,
Go ahead.
I thank you for inviting me to this. I was wondering if where can I get that zine, or is it?
Yeah. So it's going to be, it's in the process of being completed, and then it's going to be both in print form that we'll be passing out in the row and out there in our community, and also it'll be uploaded as on the website as well, so people can download it. And it's going to be a continuing piece, so definitely. So let's definitely follow up in the next couple of days, and we should have the printed copies to that. And if you want some, we can always give it to you, because then if you can share them with folks out in the street as well.
Okay, cool.
Cool. Well, already. Well, thank you, folks. So this was, thank you so much, Jamie and Bita and Shakir and Andrea and Chella and everybody else for participating. Thank you, Nadia, for bringing us the zine, and Amy sharing, thank you for sharing resources. So next Thursday, which is day after tomorrow, we'll be looking at a closer look of the expansion of police powers, expansion of the police state. As we see that, we already have Andrea, who's going to be a part of our panel, along with the Kath Roger from the National Lawyers Guild. That we want to make this into a series. One thing that we wanted to request folks were that the follow-up to this health piece was that that we want to invite folks from different parts of the city and the county in different communities and do a report back as to what they are seeing in their communities. What is their direct sort of hands-on out there impact that they see? So we would love to hear back from folks who are willing to do that. Just to send us a quick email at stoplapdspying@gmail.com. Just stoplapdspying, one word, @gmail.com, because we would love to turn that into a conversation. And thank you again, and much appreciated. Be safe and be healthy. And we will be talking to you on Thursday. Thank you.
Bye.
Bye.